Liz, you're on mute.
Let's try again. Good afternoon, everyone. My name is Liz Krueger, and I am a state senator representing the 28th District. And today we're having a town hall meeting to answer your questions about Medicare and to highlight information all of us need to know, whether it's for ourselves or perhaps someone in our family. If you are listening via Zoom or Facebook, or you're calling into the Medicare event, you're able to participate silently. If you're on a phone, we're asking you to keep that on mute. Before I get to today's proceedings, I want you to be aware of a few things. One, most importantly for many people, we've been able to add closed captioning to our Zoom and Facebook events. So as viewers, you have to activate the closed captioning to view the text on your device. If you're on Zoom, click on CC closed captioning in the meeting controls to start viewing closed captioning. If you're on Facebook live event, you will see a setting button in the bottom right hand corner of the video. Click the closed caption CC to start viewing closed captioning. Before I start with the actual program, I want to highlight a couple of, I think, important things for everyone. Let's talk about COVID-19, because who isn't talking about COVID-19? Unfortunately, our case and hospitalization rates are increasing in New York City as they are skyrocketing around the United States. And we are facing the first real jump since spring. It is critical we continue the following safety practices in order to help manage rates and prevent additional community spread. In addition to the things we think we all know about, 6-foot social distancing, wearing a mask at all times, washing our hands till our skin peels off, the governor has announced the following new restrictions going into effect tomorrow, November 13th at 10 p.m. The State Liquor Authority will limit licensed bars and restaurants to only being allowed to be open till 10 p.m. and then not open again until after 5 a.m. Restaurants may provide curbside food only pickup or food delivery after 10 p.m., but are not permitted to serve alcohol to go. Gyms and fitness centers must close from 10 p.m. to 5 a.m., and no more than 10 people may attend indoor or outdoor gatherings at private residences. Yes, we're telling you this close to Thanksgiving that it's really not safe to have large numbers of people in your home to celebrate a wonderful holiday that's frankly there for us to eat together. I'm encouraging people, sit at a Zoom and see your loved ones via the Zoom while you all eat turkey from separate dining room tables or some other model, because it is truly a risk to yourself and others to allow large numbers of people into your home or go into other homes. I wish that wasn't true, but that's what the experts are telling us. That eating and drinking surrounded by other people with limited ventilation is truly very dangerous. So the governor's actually mandating it, although I don't think he will be knocking on each of our doors. I think it's critical that we learn we have to follow these changes. I'm also urging people, just stop going to restaurants, indoor or outdoor. It breaks my heart to say that because I know what a negative impact that can have on the restaurants and the people who work at them. But we need to be alive at the end of this COVID crisis in order to continue our normal lives. So I think it's probably not that far away that these restaurants do find themselves being closed again, and office buildings. If you can work from home, work from home, because the numbers are going up at very scary rates, and we just can't afford to put ourselves back in the situation we found ourselves in a few months ago. Okay, for me, good news, I want to talk about the elections. So, of course, everyone knows we had the election and we have winners in most races. However, there are still some very close local races that need to be determined. In New York State, we have about 8 state Senate races that we're still completing the counting on, and I think approximately the same number of assembly races. I happily won my race, and I thank all of you who are my voters for your giving me the privilege to continue to represent you. And if you live in my district and you're not my voter, please be assured it doesn't matter. I believe it is my job to represent everyone in my district, whether we agree or don't agree on politics. And by the way, if you live long enough, it's almost impossible to agree with everyone all the time. So I don't expect any of you to agree with me all the time, but I do thank you very much for your vote. And in fact, we haven't even completed the paper ballot count in my race. It's just there isn't possibly a different storyline than that I won this race. I also want to highlight that we learned a lot about what we have to fix in our election system. Every time we have an election, we have things go wrong. And every time we have things go wrong, we need to go back up to Albany and change some of the laws to make sure that we are making progress in ensuring that everyone has easy access to be able to vote and that every vote is counted. I, of course, as a Democrat, couldn't be happier that Joe Biden is going to be our next president, even though there still seems to be some confusion out there in certain states. Frankly, when Fox News says Biden's won the election, you're pretty sure Biden has won the election. But I will be hosting a roundtable on what went wrong with New York City's Board of Election and its inability to manage modern elections. I'll be doing a roundtable in December that you'll be able to get online and watch if you like, or submit your recommendations for how we improve the New York City Board of Election. And finally, I want to talk to you about what we're going to be doing today. So, an overview of this afternoon's events. I want everyone to know that if you're receiving healthcare coverage through Medicare, you're probably already being inundated by advertisements and pitches from private plans. You're watching TV commercials promising you the world if you join this Medicare Advantage plan or that one. And every year you have the option to choose a different supplemental plan. And year after year, people are renewed in confusion about how you make the right decision. And you have to stick with your decision for the next 12 months. So it's actually pretty important that you try to get it right. So we are very, very fortunate to have Eric Hausman, Program Coordinator at the Health Insurance Information and Counseling Program, nicknamed HIICAP, at our Department for the Aging, who's with us today and is going to help you sort through all the different information that is coming at you if you're a Medicare recipient. Eric's an expert on all things Medicare and will provide information about coming changes in 2021 to Medicare premiums and deductions, Medicare Advantage plans, supplemental Medigap plans, and how to find out if you're eligible for programs to defray more of the costs of your health insurance. The Medicare open enrollment period ends December 7th, and information you hear today will help you make an informed choice if you want to make any changes in your coverage before December 7th. I just also want to point out we got an enormous number of people who submitted questions and an enormous number of people who signed up for this event. Eric is only going to be able to answer the more general questions, not the ones that are personal to a person's income, health concern, and existing coverage. But he has wonderfully offered to actually give us written answers to many of the questions that were asked that we will put up online for people to see even if he's not going to be answering them today on the town hall. And he will be explaining how you reach out to HIICAP after this town hall when you do have individual questions that could not be answered here, but can be answered by the staff people um, there in the HIICAP offices on behalf of the city of New York. For years and years, I have recognized that one of the really great services of New York City government is this HIICAP office that gives seniors smart, independent advice about the best health insurance options. And they're not representing any specific company. So they are listening to you, reviewing the data that they have set up on computer, and giving you fact-based recommendations of what would be perhaps the most useful plan for your purposes. And even if you think you like your plan, maybe you picked it multiple years ago. They could have changed how they're offering things. Other plans could come along that are better, or your health needs have likely changed. So it is always worthwhile when this opening comes up each year to double check whether you might be able to maximize your health insurance coverage by choosing a different plan. With that, I want to hand it over to Eric Hausman. He will do his presentation, and then I'll come back for the question and answer section. Welcome, Eric.
Okay, thank you very much. Good afternoon. So I want to start today with the Part A and Part B cost sharing. These amounts for 2021 were just announced the end of last week, so you may not have seen it yet. Starting with the Part A premium. Now, Part A hospital insurance, for most everyone, it's free. It's no premium based on your past work history. But for some people, they actually don't have the work history and they purchase Part A. And you can see that Part A can be expensive for those that don't qualify for premium-free Part A. Besides that premium, for some people, there's a deductible if you need to be admitted to the hospital. This goes up every year. So next year, for a hospital admission of up to 60 days, Medicare will pay everything but the deductible. You see, it's $1,484. If you're in the hospital beyond 60 days, for the 61st to the 90th day in the hospital, you're responsible for a daily copay. Next year, it's $371. That's per day. If you're in the hospital beyond 90 days next year, Medicare allows an additional 60, what they call lifetime reserve days, which you can use literally once during the lifetime of your Medicare coverage in any combination. But once you've used them, that's it. They're non-renewable. For those 60 lifetime reserve days next year, it's $742 per day that you're responsible for. If you're discharged from the hospital to a skilled nursing facility for rehab care, Medicare will pay the first 20 days there in full. The next 80 days, you're responsible for daily copayment. Next year, it's $185.50, and again, that's per day for days 21 through 100 in a skilled nursing facility. And these Part A benefits, they're not a calendar year benefit like Medicare Part B. Instead, it's per what they call a benefit period. And a benefit period begins the day you're admitted to the hospital, and it ends when you've been out of the hospital, out of the skilled nursing facility for a period of 60 consecutive days, at which point your benefits renew, they start again. So if in January you need to be admitted to the hospital for 5 days, Medicare is going to pay everything except that deductible, $1,484. But in February, if you need to be readmitted to the hospital or a different hospital, same condition, different condition, doesn't matter. Less than 60 days have gone by since your discharge. You're still in the same benefit period. You just pick up where you left off at day number 6 of your first 60 days of coverage. You don't have to meet a new deductible. But instead of being readmitted in February, what if you're admitted 3, 4, 5, 6 months later? It's still the same calendar year, but now it's a new benefit period. More than 60 days have gone by since you discharge. Your benefits renew, they start again. You're back to day number 1 of your first 60 days of coverage, and you have to meet a new deductible. So I hope that will help to point out the importance that people have other insurance besides Medicare. And when we talk later about Medigap, Medicare supplement insurance, you'll see how that fills in very nicely here. Now on the Part B side, there's an annual deductible. Next year, it'll be a little higher, $203. And that means the first 203 in covered medical expenses next year, that's your responsibility, unless you have other insurance to pay that for you. Once you meet the deductible, Medicare pays 80% of what they allow. You're responsible for the other 20%, the Medicare co-insurance. Now, most everyone gets Part A for free, but Part B, they pay for that. So next year, the Part B premium will be increasing to a little bit to $148.50 per month. But there are some people that actually pay a higher premium because they have a higher income. And for next year, we're talking about people whose incomes are above 88,000 if they're a single, 176,000 for a married couple. So you see in this chart different levels of premium beginning at 88 and 176,000. And the way they determine that for 2021, they're going to look at your 2019 return. And if your what they call modified adjusted gross income from 2019 was above that threshold, you're going to get a
I'm going
notice.
to interrupt you for a moment. We're having some difficulty with your audio connection. It's possible that it's a bandwidth issue. If you mute your video, that might improve it. So we won't see you. We'll still see your shared screen, and hopefully that will help improve your audio quality.
Okay. So we were saying about the Medicare Part B premium for people with a higher income for 2021, it's going to be based on your 2019 return. And if your income is above the threshold, the 2019, the threshold of 88,000 or 176,000 for a single or married couple, you will get a notice late this year to let you know you'll be paying a higher Part B premium for next year. Okay? Now, for a lot of people, their income may have gone down in 2020 because they stopped working or their spouse stopped working. Well, if that's the case, initially they're going to base your premium for next year on 2019. But what I would do is I would then contact Social Security and say I had what they call a life-changing event, a change in my work status or my spouse's work status. And then instead of basing it on 2 years ago, like you do by default, I want you to base it on the more recent 2020 tax year. And somebody can save sometimes significantly on their Part B premium, as you can see from this chart, as a result of that. So again, for 2021, it's going to be based initially on 2019 return. But if your situation changed because of your work status or your spouse's work status, contact Social Security and ask them instead to base it on the more recent 2020 tax year. And as you can see from the third column of this chart, for those that pay a higher Part B premium based on their income, if they also have a separate Part D drug plan, which we'll talk about later, they pay an additional surcharge for their Part D drug coverage as well. And it's paid in the same way as their Part B premium. It's either taken out of their Social Security check, or if you're not collecting Social Security yet, it's billed to you directly. Now, there were some changes that happened with original Medicare that I want to mention today. They started to cover for acupuncture. There's a new ABN, Advanced Beneficiary Notice form. Competitive bidding refers to durable medical equipment coverage. And I'll mention some things specific to COVID-19 in Part B. So historically, Medicare never covered for acupuncture. However, starting the beginning of this year, January 2020, Medicare started to cover for acupuncture for the first time, but only for people that have one particular condition, chronic low back pain. If you do, Medicare will cover up to 12 visits in 90 days, plus an additional 8 sessions for those demonstrating improvement, 20 in a calendar year. Okay, like most Part B services, subject to the deductible and 20% coinsurance. But the thing to know is acupuncture for any other condition other than chronic lower back pain remains non-covered under the original Medicare program. The Advanced Beneficiary Notice, ABN, this could be very important if you're ever asked to sign this at the doctor's office. It deals with the issue of medical necessity with Medicare. Now, if Medicare ever denies a service as not medically necessary, the beneficiary is not liable. You are not liable to pay for that service unless you have signed a specific standard ABN form prior to the service being done. Because a lot of times, I know, especially the first time you go to a new doctor, they probably have you fill out this long intake form. And on the bottom will be some sort of blanket waiver statement, something like, I agree to be responsible for services not covered by my insurance. That kind of blanket waiver for Medicare is not effective at all, not at all. It must be the standard form that indicates the exact service being done and the reason the doctor feels it may not be covered by Medicare. If you sign the form, the provider will still bill Medicare. Medicare might actually pay the claim, but if Medicare denies it, you're responsible. If you decide you're not signing this form, you should expect that the provider will not render that service because they don't want to be held liable for that. So Medicare never tells you in advance whether a service is going to be covered. It's really under original Medicare, your provider notifying you in advance that a service may not be covered through the use of this form. This form does not apply to services that are excluded, that are never covered, something like a hearing aid, or dentures. Those are always your responsibility. But if it's a service that Medicare can cover, let's say like an X-ray or an MRI or a visit to the chiropractor, but due to your particular condition or due to the frequency with which you have the service, Medicare considers it not medically necessary, you're only liable if you have signed this particular form prior to the service being done. There's an updated version of that form that providers will be required to use starting next year, okay? But it's still the same information, which indicates, again, the exact service being done and the reason the doctor feels it may not be covered by Medicare. And then competitive bidding, this is coming back next year for people that live in New York City and most, if not all of the state, for that were in original Medicare and receive one of these 15 product categories of durable medical equipment, including things like you see there, wheelchairs, walkers, oxygen equipment. Starting next year, if you're on original Medicare and need any of these items, you must use what they call a contracted supplier. Contracted suppliers are suppliers that won these bids in order to continue to provide these items and services under Medicare. They won for the competitive bidding area for these categories of equipment. And the good thing about contracted supplier is they are mandated to accept assignment on claims, meaning they are mandated to accept whatever Medicare allows as their full payment. You're still responsible for the annual deductible and 20% coinsurance, but no more than that. If you use a non-contracted supplier for one of these items, they need to give you an ABN form. That's another use of the form to let you know in advance that it will not be covered by Medicare. You can find these contracted suppliers on the Medicare website, medicare.gov, or through 1-800-MEDICARE 24/7. The COVID-19 vaccine, when that becomes available, that's going to be covered by Medicare Part B, the same way the flu vaccine is covered today, at 100%, not subject to deductible or coinsurance. And the COVID-19 testing to rule out or diagnose the condition for the antibody test, like other lab tests, that's covered in full by Medicare. And then we've heard a lot about telehealth, right? Telehealth visits via electronic communication used to only be covered under Medicare for people that lived in certain rural areas that had services at a facility. But now it's available, they really opened it up under Medicare for people throughout the country and that have different types of services, including office visits, where they can be done via telehealth, so they don't need to leave their home. It could be for new patients as well as established patients. Providers can waive the deductible and coinsurance, but in the end, if they don't, beneficiaries are responsible for that. Now, the most important thing this time of year is about choices in Medicare. And for people with Medicare, especially those that live in New York City, they really have a lot of choices as to how to get their Medicare coverage. But basically, for everybody, it all boils down to two choices. There's only two ways to get your Medicare. Everyone with Medicare can either be in original Medicare or they can be in a Medicare Advantage plan. It's one or the other. Now, for those that choose original Medicare, you saw there were big gaps in coverage, deductibles, coinsurance. So how do people fill in the gaps? Well, some people on the call today, I bet, have retiree health insurance from their own or their spouse's former employer or union that fills in all or most of the gaps in coverage. Other people that have very limited income and resources might have Medicaid in addition to Medicare, in which case Medicaid fills the gaps. For those that don't have retiree coverage and don't qualify for Medicaid, they might purchase a private Medigap, Medicare supplement plan. If you're on original Medicare with the Medigap plan, it does not cover your drugs. So you would need to purchase a separate Part D drug plan for an additional premium. So the people in this first column that have original Medicare with the Medigap and the Part D plan, they have the most choice of providers, doctors and hospitals across the country. And depending on which Medigap plan, the most complete coverage, but in exchange, they pay the most in premiums. What about the other side, Medicare Advantage? These are private plans. They're contracted with Medicare to provide all of your benefits through a network of doctors and hospitals. And if you join a plan, some of those plans are as low as zero premium. They include the Part D drug coverage, so you save on those premiums. Plus, you get some extras that Medicare doesn't cover, things like dental and vision and hearing. But in exchange for that, you need to be able to work within a network of providers, and it's not complete coverage for most services under most plans. And you'll pay when you go to the doctor or hospital or receive other services up to a maximum out of pocket for the year, or copay or co-insurance. Plus, it's managed care. So you may need to get pre-approval, prior authorization for some services to be covered. So for some people, it makes more sense to have original Medicare with the Medigap plan. Other people do very well with the Medicare Advantage plan. And again, that's the choice to make during this annual election period ending December 7th. Now, for those that choose original Medicare that don't have the retiree coverage, they may purchase a Medigap, a Medicare supplement plan, like you see advertised on TV from AARP. There are 10 standard plans. They're identified by letter, ranging from plan letter A to plan letter N into Nancy. All of these Medigap plans cover certain things. They all cover you for days 61 through 90 in the hospital. They all cover the 60 lifetime reserve days. Plus, if you exhaust your Part A benefits, they'll cover you for another 365 days of inpatient hospital care. Most Medigap plans pay the Part A deductible. Most Medigap plans pay the entire 20% coinsurance for Part B. And then other benefits vary from plan to plan. But here's the two most important things to know about Medigap insurance. One is that it's a standard benefit. So different companies sell these plans and they charge different amounts. But as long as it's the same letter plan, doesn't matter what they're charging. It's exactly the same coverage. So if you purchase plan G as in George from Empire or from AARP, it's about $270 a month. But other people have plan G from other insurers that are over $300 or $400 a month. It's no additional coverage. Okay, it's exactly the same. As long as it's the same letter plan, again, it's a standard benefit, and whoever you get it from and however much you pay, it's exactly the same coverage. The other thing to know, in New York State, unlike most states, we have continuous open enrollment for Medigap insurance. And that means as long as you have Part A and Part B, it doesn't matter if you're over 65 or you're disabled with Medicare under 65, you could purchase a Medigap plan anytime at all. They can't limit you to only enrolling when you're first eligible or during certain times of the year, not in New York State. Not only that, if you got a Medigap plan already and you live in New York, you could always switch, okay? If not to the same Medigap insurer, to another one. And they cannot deny you because of your age or health status for Medigap insurance, not in New York State. However, what you may run into is a waiting period for pre-existing conditions of up to 6 months, which most but not all the insurers have. So what that means is, although they'll sell you a plan at any time, they may not cover a service related to a pre-existing medical condition for up to the first 6 months. However, most people are able to avoid the waiting period because they've had some sort of prior creditable coverage, such as another Medigap plan, a Medicare Advantage plan we'll talk about next, employer plan, retiree plan, COBRA, as long as there's no break or short break of less than 63 days from when that ends and the Medigap plan begins, they'll credit the time, again, with the prior coverage towards meeting the waiting period. So for instance, if you're somebody that's been on a Medicare Advantage plan all year But January 1st, you're going to switch to original Medicare with the Medigap. You don't have to worry about pre-existing conditions. They will credit that year you were with the Medicare Advantage plan towards meeting it. And because most people we see that buy a Medigap plan have had some sort of prior creditable coverage, they wind up not being subject to that waiting period for pre-existing conditions. If you want to see which companies sell which plans and exactly how much they cost per month, along with the waiting periods, you should go to the New York State Department of Financial Services. That's the website and the link to that they update every month and for the latest information. We also have a chart that's taken from our publication, The Complete Guide to Healthcare Coverage for Older New Yorkers, which you can download from the Department for the Aging website, nyc.gov/aging. And this is a chart of the available Medigap plans, the 10 standard plans from plan letter A to plan letter N. But I want to tell you about a change that happened this year, okay, with two of these plans, Plan C and Plan F. You'll notice those are the two plans that cover the annual Part B deductible, that $203 deductible next year. Here's the change. Starting this year, 2020, for people that are new to Medicare, newly entitled to Medicare, newly eligible for Medicare, they cannot purchase a plan that covers the annual Part B deductible. So again, we're talking Plan C and Plan F. However, if you are somebody that was eligible for Medicare prior to this year, even if you didn't enroll in Medicare, because maybe you're still working or you're covered under a spouse is still working, that doesn't matter. If you were eligible for Medicare prior to this year, and now you're enrolling in Part B for the first time, even if that's this year or next year, you're entitled to Plan C or Plan F. You can purchase that. It's only the people that are newly entitled to Medicare, like somebody, for instance, that's just turning 65 this year. They can't get Plan C or Plan F. They can get Plan D or Plan G, which you can see is exactly the same plan. It just doesn't cover the Part B deductible. But Plan C and Plan F, again, the most comprehensive plans, are only available for people that became Medicare eligible, okay, prior to 2020. So far, we're talking about original Medicare, which might come along with a Medigap plan. This is the other way to get your Medicare, to join a Medicare Advantage plan, a Medicare health plan. This is Part C of Medicare, okay? Nobody calls it Part C, though. It's a Medicare Advantage. And we said earlier, these are private plans that are contracted with Medicare to provide all of your Medicare benefits through a network of doctors and hospitals. And there are two changes for 2021 when we're talking about Medicare Advantage. One is with the maximum out-of-pocket limits. They went up for next year. And for people with end-stage renal disease, kidney failure, they're newly entitled to Medicare Advantage beginning in 2021. So let's talk about each of those. So all Medicare Advantage plans have co-payments or co-insurance, amounts that you're responsible for most services under most plans. So for instance, if you join a Medicare Advantage plan, some plans have no co-payments for primary care doctors, but they all do for specialists, some as high as $50, okay? If you're admitted to the hospital, plans usually have a daily copayment, $200, $300, $400 a day, up to a certain number of days, around 5 days or so, okay? And that varies by plan. But in fairness to the plans, it's not an unlimited amount that you're responsible for the year. All Medicare Advantage plans, HMO and PPO plans, have a maximum out-of-pocket limit, Moop, okay? Not to exceed next year, it could be higher, up to $7,550 in network, like an HMO plan, or $11,300 could be as high as for a PPO plan. So what does the Moop include? Well, it does not include any premium you might pay, does not, okay? It does not include the Part D drug coverage, which is completely separate and has no out-of-pocket limit. It does not include out-of-pocket costs you may pay for services Medicare doesn't cover, like for dental or vision. The Moop limit includes Part A and Part B, hospital and medical covered services. So if you have a plan with a $7,550 limit next year and you go to the specialist, it's $45, the $45 goes towards the limit. You're admitted to the hospital, it's $300 a day for the first 4 days. That $1,200 out of your pocket goes towards the limit. And if you reach that limit, most people won't, but if you do, 100% coverage for the rest of the year for all Part A and Part B covered services. 7,550 and 11,300 are the highest limits any plan can have next year. Many plans do have those limits in our area, but there are also plans with lower limits. And that might be something you want to consider when you're comparing between the different Medicare Advantage plans for 2021. The other change for next year is for people in terms of their eligibility. Now, people were always eligible for Medicare as long as they had Part A and Part B, Medicare Advantage, I should say, as long as they had both Part A and Part B, and they live in the service area of the plan. Historically, though, people that had end-stage renal disease, kidney failure, have not been eligible for Medicare Advantage with limited exceptions. But that's all changing. Starting next year, they will have the same right as anyone else to join a Medicare Advantage plan. Now, while that's true, I think they should be cautious about that decision because most all Medicare Advantage plans in our area have 20% cost sharing for dialysis, okay, a service they're going to need on a regular, ongoing basis, up to the maximum out of pocket, of course, for all Part A and Part B covered services. Compare that with the original Medicare and the Medigap plan, most all Medigap plans, where you would have 100% coverage, complete coverage for dialysis. So I think that's something that people with end-stage renal disease should certainly be made aware that they're eligible for Medicare Advantage. But prior to joining, I would suggest that they check to see what their out-of-pocket costs will be for dialysis, okay? Again, and compare that with their coverage under original Medicare with the supplement plan. Now, when can you join the Medicare Advantage plan? Well, you could when you're first eligible for Medicare and enrolled in Part A and Part B. You could also join or switch plans during this annual election period that was mentioned earlier that runs every year from October 15th to December 7th, where you can go from one Advantage plan to another, back to original Medicare, the other way around. If you're on original Medicare, you can switch your Part D drug plan. Whatever choice you can imagine, you can make during this time. And if you do, your new plan will be effective January 1st. If you decide to go with the Medicare Advantage plan, there's a second enrollment period. It's called the open enrollment period. Every year from January through March, anybody that's on a Medicare Advantage plan has one additional opportunity to either switch to another Medicare Advantage plan or to original Medicare one time between January and March to be effective the first of the following month. You cannot use this period to go from original to a Medicare Advantage plan, or if you're on original Medicare to switch your Part D plan. No, that's what you need to do now between now and the end of December 7th, okay? What you can do during this open enrollment period, it's only for people that are already in a Medicare Advantage plan. They have the one chance, again, to switch to another plan or to original Medicare. After March, for most people, whatever plan they're on, if they're on a plan at all, that's what they're going to have for the rest of the year. Now, a lot of people are aware of this January through March period, but what they don't realize is that it's also available for people that are newly entitled to Medicare, that take a Medicare Advantage plan when they're first eligible. They have the first 3 months of their entitlement to switch, again, to another plan or original Medicare. This is important because so many people are turning 65 or becoming eligible due to disability nowadays. As time goes on, more and more of those people are taking a Medicare Advantage plan when they're first eligible. They may not know that they have that first 3 months, okay, to switch, because who's telling them that? The plan they just enrolled in? Maybe not. So it's important for you to know that if you're taking a plan when you're first entitled to Medicare, for you, it's like January 1st. You have that first 3 months of entitlement to switch. So if you took a Medicare Advantage plan when you turn 65, let's say in October, you have October, November, and December, okay, to use this open enrollment period to make a change. The next section is about Part D, and I wanted to give you the new 2021 numbers for Part D. So next year, Part D drug plans can have deductibles as high as $445. You'll notice that many plans have the $445 deductible. Some have a lesser deductible. Some have zero deductible. 445 is the most it could be. And then you'll reach the coverage gap, the donut hole that I'll talk about more on the next slide, when you reach a certain amount in drug costs for the year. Next year, that's going to be $4,130. So once you reach $4,130 in total drug costs next year, regardless of what you paid out of pocket to that point, when the total cost of your drugs gets to $4,130, now you're in the coverage gap. Now you're in the donut hole, okay? And you pay 25% of the cost of the drugs out of pocket until, for people with very high drug costs, they may reach what they call catastrophic coverage. Catastrophic coverage begins next year at the point that they reach $6,550 in TROOP, T-R-O-O-P, true out-of-pocket costs. And I'll define that on the next slide in more detail. And if you get to that $6,550 in true out-of-pocket costs, now your costs go down dramatically because you're paying no more than 5% of the cost of the drugs, or co-payments a little higher next year, up to $370 generic, $920 for brand. Now, some people on the phone today, I bet, remember that when Part D first started in 2006, people that reached the coverage gap paid 100% of the cost of the drugs out of their pocket. But over time, they reduced it. And 2020 was finally the year we got to the point where people that reached the coverage gap for both brand and generic drugs pay no more than 25% of the cost of the drugs. So how do you get to the coverage gap? Again, we said that's determined by the total cost of your drugs when it reaches $4,130 next year. Okay, again, regardless of how much you paid to that point, you're in the coverage gap. You're paying 25% of the cost of the drugs out of pocket until you get to catastrophic coverage. The catastrophic coverage next year, we said, begins at the point that you reach $6,550 in true out-of-pocket costs. So what does that include? Everything that comes out of your pocket, everything you pay for, not the premium you pay, everything else you pay. Deductible, co-pay, co-insurance, the 25% during the gap, plus there's one cost you don't pay, which luckily counts towards that $6,550, and that is during that coverage gap for brand name drugs, not generic, brand name drugs, which can be very expensive, that what you don't see, you're paying 25%, but of the other 75%, 70% of that, most of that cost is a drug manufacturer rebate. Even though it doesn't come out of your pocket, luckily, that 70% rebate counts towards $6,550, and that's good for you because that gets you out of the coverage gap, okay, out of the donut hole, and to the catastrophic coverage much more quickly for many people without having to pay nearly $6,550 out of their pocket. Something else for 2021 I wanted to mention about the Part D explanation of benefits. Now, for those that have Part D drug coverage that fill medications at the pharmacy, you should be getting a monthly statement from your plan, which explains about the cost and what you paid and where you are towards meeting the deductible, where you are towards reaching catastrophic coverage. Now, in addition, starting next year, plans will be required to include information on lower cost drugs that they cover for your condition. So all the plans cover multiple drugs for whatever condition that you may have or you develop in the future. Your plan may be covering your drug, but at a high cost. If there are lower cost therapeutic alternatives that the plan covers, you'll see information on them right on your explanation of benefits to encourage people to have a conversation with their doctor who's prescribing the drug to see if they could prescribe something else that the plan will cover at a lower cost. And then this is brand new for next year, the senior savings model. This has to do with insulin, which can be provided at a high cost sharing under many Part D plans for those people that do not receive extra help, the low income subsidy, a subsidy that helps with their Part D drug costs. Okay, for those that don't receive it, okay, if they're on one of these plans that participates with the senior savings model, then the plan will provide a broad range of insulin drugs at a flat $35 copayment. So during the deductible phase, during the initial coverage, when you're getting towards the coverage gap, during the coverage gap, you'll be paying no more than $35. Okay? And that could be very important for people, again, that are not getting extra help and are struggling with the cost of the insulin under their Part D plan. This is only one factor, though, in your plan choice, of course. You need to see about what the cost would be for other drugs under the plan. If you're in a Medicare Advantage plan, there are other considerations as well to see if the plan meets your needs. But you may want to look, again, for those that you're helping or yourself that are using insulin to see if enrolling in one of these plans may save you next year some of the cost. Now, to give you an idea, for people in Original Medicare, there are 28 standalone Part D plans that work with Original Medicare. 8 of them are participating with the insulin savings model. And there are several companies that have Medicare Advantage plans that are also participating with this. You can identify these plans by going to the Medicare.gov website, searching for plans. You're able to sort, by insulin savings to identify the plans that are participating for 2021. And then very important for next year, there are some plans that are terminating that will no longer be available. So for people in Original Medicare, currently there are 2 companies, Journey and Magellan, that are offering standalone Part D plans, but those plans are ending the end of this year. Okay. Also, for those that live in Manhattan, Medicare Advantage plan, Empire MediBlue Plus from Empire Blue Cross and Blue Shield, they're terminating that plan. And the Humana Choice PPO plan for $207 monthly premium, that plan's also being terminated for next year. Now, Empire and Humana have other Medicare Advantage plans that are available, but these plans are being terminated. So what happens if you're in a plan that's being terminated? It depends if you have extra help, the low-income subsidy. So ideally, people that are in a plan that's terminating, they paid attention to the notice they would have received by the beginning of last month. And currently, those folks are working to find a new plan for 2021 that meets their needs during this annual election period. However, if you do not choose a plan, okay, what's going to happen is come January 1st, you're going to be on Original Medicare because Original Medicare is always the default. If you have extra help, like somebody that has Medicare and Medicaid, for instance, they do not allow you to be without a Part D plan. So if you do not choose a plan, come January 1st, you have extra help, they're just going to stick you into a standalone Part D plan that works with Original Medicare. If you are somebody, though, that does not have extra help and you don't choose a new plan, January 1st, you're going to find you have Original Medicare and no Part D drug coverage at all. Fortunately, there's a special enrollment period for these individuals whose plan is terminating. It begins December 8th after the annual election period is over and runs through the end of February. So in case you know somebody who doesn't realize their Magellan plan terminated until they go to the pharmacy for the first time in January and show their Magellan card, luckily, this special enrollment period will allow them till the end of February to enroll in a standalone Part D plan or Medicare Advantage plan with Part D. So they do not need to be without Part D drug coverage for the remainder of 2021. Something else to let you know is about plans that change their name. So people today may have a standalone Part D plan with Original Medicare from Envision. That company has changed its name to Elixir, E-L-I-X-I-R. Okay, it's the same plan, same company, just a new name. And you may have also noticed that SilverScript was purchased by Aetna. So with SilverScript, though, they're still using the SilverScript name for their plans. However, you'll also see Aetna. And if you look for the insurance company name, it's only under Aetna. So in the last section, I just want to tell you about 3 programs that help with your Medicare Part D costs. The first one is called Extra Help, the low-income subsidy. And we said before, this is a subsidy the government provides to help people with their Part D costs. Some people get it automatically. If you have both Medicare and Medicaid, or you're on one of the Medicare savings programs, where the state pays your Part B premium, it's not taken out of your Social Security check, then automatically you get full extra help with Part D, which means you can get a Part D plan for no premium, and only small co-payments for your covered medications. If you're not on Medicaid and you're not on a Medicare savings program, but you have limited income and limited resources as well, you won't get this assistance automatically, but you may be able to apply to get, if not the full subsidy, at least a partial subsidy. The place you'd apply to, Social Security. You can do that any time of the year, best done on their website, Social Security or SSA.gov. You need to have an income less than 150% of the federal poverty levels. So what are we talking about? For a single person, not much more than about $1,600 a month, plus limited resources as well, about $15,000 for a single. If your income and resources are above those amounts, you will not qualify for the subsidy, and you'll pay the full cost of the premium, the full cost sharing for the drugs under the plan that you choose. Another benefit of getting extra help, the low income subsidy, unlike most people who can only change their plan during this annual election period, people with extra help have more flexibility. They can change their plan as often as once per calendar quarter in the first 9 months of the year. So if you know somebody that has Medicare and Medicaid and they're on a Part D plan, they can change their plan one time between January and March. They can change their plan again between April and June, again between July and September, one time each quarter in the first 9 months of the year. During this last calendar quarter, they're limited to the same annual election period, October 15th to December 7th, as anyone else. Now, EPIC is New York State's State Pharmaceutical Assistance Program, SPAP, and it's for New York State residents that are 65 and over that have an income from the previous year of no more than $75,000 for a single person. $100,000 is the limit for a married couple. They don't look at your assets or resources, only income to qualify, but EPIC does not work on its own. EPIC only works as a supplement to your Part D drug plan. And it works with every Part D plan, whether you have a Part D plan with original Medicare, one of those 28 for next year, or you have a Medicare Advantage plan with Part D, it doesn't matter. It's all Part D. EPIC works with them all. Where Part D is your primary insurance, EPIC wraps around. EPIC helps to fill in the gaps in coverage. Now, there's one gap that EPIC does not help with, and that is your Part D plan deductible. So if you have a Part D plan with a deductible, which we said could be up to $445 next year, EPIC's not paying that. But once you meet the deductible, EPIC can reduce your copayments. EPIC can help you with the coverage gap. EPIC can help you with the catastrophic coverage where you're paying 5%, but for some people, 5%, it's a couple $100 for really expensive medications. You know, with EPIC, maximum copay you pay, $20. And what does EPIC cost? For most people, it's free. So if you are a single person and you have an income from the previous year between $20,000 and $75,000, like many people do in New York State, you would be in EPIC's what they call deductible plan, where EPIC, you don't have to pay anything for it, but you'll have to meet a deductible on a sliding scale based on your income before EPIC will pay for your drugs. But if you're somebody that has Part D and you're eligible for EPIC and you have an income, $30,000, $40,000, $50,000, $60,000, I don't see any reason for you not to sign up for EPIC. Sometimes people say to me, you know, I don't use a lot of drugs. How am I ever going to reach this deductible? It's $1,000. It's $2,000. But I would say, so what? You don't reach the deductible. It doesn't cost you anything. It's free coverage. In the meantime, you have EPIC in place should your situation change. And let me tell you one more benefit of EPIC. Unlike most people who can only change their plans once a year between October 15th and December 7th, EPIC members can change their plan one additional time each year. Part D, Medicare Advantage plan with Part D, one additional time each year to be effective the first of the following month. So for some people, it's worth it to join EPIC just to be able to change plans without having to wait till the next year. And if you're not an EPIC member already, you can sign up anytime at all. It's always open enrollment for EPIC. Now, unlike extra help that you can apply for online, with EPIC, it's a paper application, which you can get from EPIC directly or from many pharmacies, they have it, which you can mail or fax to EPIC for processing. And then the last benefit I'll talk about today is probably the most important benefit that we help people with, and that is called the Medicare Savings Program. The Medicare Savings Program, for those people that qualify and apply, it pays the Part B premium. It puts that 144.60 this year back into somebody's Social Security check. If you ever met anybody that has Medicare Part B and they're not paying a premium, they're already on the Medicare Savings Program. But if not, they may qualify. There are 3 Medicare savings programs. You see them here with the income limits, the monthly income limits. The first is the QMB program. Now that program not only pays the premium, but it also acts as a supplement to Medicare in that it eliminates any Part A or Part B cost sharing. So for instance, if you're on original Medicare and you have QMB, you cannot be billed for that 203 deductible next year. You cannot be billed for the 20% coinsurance. If you're on a Medicare Advantage plan, you cannot be billed for any copayments or coinsurance for doctor or hospital services. The QMB eliminates your responsibility for that. Even if your doctor doesn't take Medicaid, even if the doctor never heard of QMB, even if you're receiving covered services in another state, doesn't matter. You have QMB, you cannot be balance billed, meaning you cannot be billed for any Part A or Part B cost sharing. Now, the other 2 programs, the SLMB and the QI program, those programs just pay the Part B premium, the 144.60 this year, but they also automatically make you eligible for full extra help with Part D. And a couple of real big advantages living in New York. First of all, we don't have, they don't look at your assets or resources. Like Epic, they only look at income to determine eligibility for this. Plus, even if your income's a little too high, you may still qualify. Because if you're paying privately for health insurance, they allow you to deduct your health insurance premiums from your income to qualify for this benefit. Now, you cannot deduct the Part B premium because this program pays the Part B premium, but other premiums you can, such as a Medigap plan. So if your income's $1,600, right, but you're a single person and you're somebody that's paying for Plan N from AARP $200 a month, you can deduct that $200 a month from your income, and now you qualify for the QI program. If you're paying for long-term care insurance, that could be really expensive. You can deduct that premium. Other times we meet people whose income's only slightly above the limit, $5, $10. For that person, it might be worth it to buy some cheap dental policy or vision policy. You ever see them advertised on TV or in the newspaper for $20 a month? Because paying that $20, now you're saving the 144.60, a little more next year. Plus, you're automatically getting extra help with Part D, so you can get a Part D plan for no premium and only small co-payments for your drugs. So this is really valuable for people that have very limited income, but they have some resources, right? That's what they're living on. Their income's only $1,000, $1,200 a month, but they have $30, $40, $50, $60,000 in the bank, okay? If that person applies to Social Security for extra help, they're going to be denied, okay, because their resources are above the limit. This is the back door to extra help. Apply for the Medicare Savings Program. They're only looking at income. And now you get that same extra help with Part D as a result of your acceptance for this benefit. Okay, and that's the update that I have for you today. And I'll be happy to answer any questions, and we'll provide our phone number for HIICAP if you have any questions about Medicare or related insurance. Thank you.
Thank you. Well, so first off, Eric, you are clearly a human encyclopedia on these issues. And I was just listening and amazed at how you could just keep jumping from issue to issue to issue. So again, I earlier said HIICAP is one of the great secrets of quality city government programs. And I think that my staff are putting up the phone number for HIICAP in a variety of places. So, and people will definitely call in follow-up for their own questions. I also appreciate when you turned off your visual, your voice got so much clearer for everyone, which is really what we wanted to make sure. So I'm sorry that we had you turn off your visual, but it actually helped quite a bit to be clearer. And I don't know, we can fight with Spectrum later on your behalf or something, because some people's systems just don't handle voice and picture well enough. So now I have a whole series of questions that you had seen in advance, but just one that came in quickly. Somebody thought they heard you say Part B excess as part of a presentation. Is there an excess program in Part B, or did we all hear that wrong?
So when we refer to Part B excess, and you may have seen that in the slide when I talked about Medigap insurance. So that refers to doctors who do not accept what Medicare's assignment on claims. They do not accept what Medicare allows as their full payment.
Got it?
They're able to bill a little bit more than what Medicare allows, an additional 5 or 15% above what Medicare allows. That's the Part B excess that some Medigap plans, including Plan F and Plan G, cover, but most Medigap plans do not.
Got it. Okay, so
If the doctor accepts assignment, which is true for most every claim that Medicare receives nationally,
right,
then they're not allowed to charge that excess.
got it. And do any of these programs cover foreign travel?
Well, Medicare itself does not cover services outside of the United States and its territories, like Puerto Rico or the U.S. Virgin Islands. Right? If you have a privately purchased Medigap plan, you'll notice that most of them, but not all, provide coverage for foreign travel emergency services. If instead you're on a Medicare Advantage plan, many of them also cover for foreign travel services outside, emergency services outside of the United States, but not all plans necessarily.
Thank you. So if you are planning travel in the next 12 months, you might think about making sure you double check that. Although with COVID, I'm not sure where any of us are even allowed to travel, including across state lines. But in a normal year, in a normal time, I think that is a relevant question for many retirees. Okay, let's go to the questions that people gave us in advance. And again, for anybody who started late with us, we got a huge number of questions for Eric, but so many of the questions are really so specific to a personal household situation, the health issues that family's facing, the medications that family may be needing, different illness groups. So we're not answering those questions today. We know you want answers, and we want to help you, but we're not doing that over the Zoom. But again, we're encouraging people to call HIICAP, get an appointment, and have a review done for themselves where they can ask all the relevant questions to their specific needs. And again, your open framework for changing what your Medicare supplemental program sign up is you have to do it before December 7th. So that's why we're doing this town hall now, because we want to make sure people have time to do their own homework, to get some help reviewing what their current insurance coverage is, and whether, because of all these different changes that happen, quite a few this year, but they happen every year, we want to make sure that you know that you can have someone help you review whether your current coverage remains the best option for you, or whether because of a change in your circumstances or a change in coverage, you'd be better off choosing another option. So with that, what's the penalty if someone doesn't sign up for Medicare Part A, B, or D when they turn 65? And are there any exceptions to these rules?
Well, with Medicare Part A hospital insurance, more than 99% of people get that for free for no premium. You do have the work history to qualify for premium-free Part A. You can sign up at any time without penalty. For Part B as in boy, you can only delay enrollment in Part B without penalty if you are covered when you're first eligible for Medicare under your own or your spouse's active current employment. Okay, not retiree plan or COBRA, but active current employment, you or your spouse. As far as Part D drug coverage, you can delay enrollment in Part D if you have other what they call creditable drug coverage from another source, which could be, again, through an employer, or it could be through some sort of retiree policy. It could be through the VA for veterans. If you have credible drug coverage, you can delay enrollment in Part D without penalty. But again, for Part B medical insurance, you can only delay without penalty if you are covered at 65 under your own or your spouse's, not domestic partner, your own or your spouse's active current employment, not retiree plan, and certainly not COBRA. Okay, that's the only exception.
And we know that sometimes people didn't know those rules. They reach out to us years after where suddenly they do need to sign up for something and they discover that they're going to owe pretty hefty penalties. These penalties can be significant, right?
Sure. So the penalty for late enrollment in Medicare Part B medical insurance is 10% of the year's standard premium for every full 12 months you delay. So that 10, 20, 30, 40, 50, 100% or more penalty, not one-time penalty, it's a lifetime penalty. For Part D, the drug coverage, it's 1% of a national average times the number of months you delay, and also a lifetime penalty. Although it's a lifetime penalty, an exception, there's always exceptions for Medicare. If you later qualify for extra help, your Part D late enrollment penalty will go away. If you later qualify for the Medicare Savings Program, where the state will pay your Part B premium, that would also eliminate any late enrollment penalty. So that helps people sometimes very significantly who have accumulated large penalties, but have limited incomes and can qualify for these benefits.
Great. So some people might think they're watching today or listening today on behalf of their parents and they're helping them with their Medicare updates. But hello, if you're getting close to the age of Medicare eligibility, you need to learn these things for yourself now also. Okay, what are the primary differences between original Medicare and Medicare Advantage plans? And what are the advantages and disadvantages of one over the other?
Okay, well that's the key question, for this time of year. That's the biggest question we get, right? So basically, with the original Medicare and a supplement plan, for those that don't have retiree coverage and don't have Medicaid, here's why you would do that: to have the most choice of providers. If you're on original Medicare, you can go to any hospital across the country. They all take Medicare, and most, but not all, doctors. Okay? And depending on which Medigap plan, you can have very complete coverage. So somebody with original Medicare and Plan F, they pay nothing out of pocket when they go to the doctor or hospital. But what's the downside? High premium for the Medigap plan, plus you need to buy a separate Part D plan. So they're paying more in premiums to have more choice and more complete coverage. The Medicare Advantage plan, you're saving on those premiums. Some plans are zero premium. You still pay the Part B premium, whatever you do, but zero additional premium. They include the drug coverage. Yeah, you don't need the supplement. You don't need a separate Part D. You save on those premiums. Plus, you get some extras that Medicare doesn't cover: dental, vision, hearing, gym membership. Okay, but if it's an HMO, like most of them are in New York City, you have to be able to work within a network of doctors and hospitals, and it's not complete coverage. You pay something on the other end when you access care, co-payment or co-insurance, up to that maximum out-of-pocket limit that we spoke about. Plus, it's managed care. So you may need to get pre-approval for your mental health services, for your physical therapy, for your planned surgery.
Great. Eric,
I would say those are the advantages.
My tech staff had just pointed out you could stop sharing your screen now and turn your video back on, and we can see whether your voice will be fine without the shared screen.
Okay.
Okay. And I'll start the next question as you're experimenting with that. So Medicare Part D coverage for medications seems to be pretty expensive for a person who has only a few medications they take. Are there less costly alternatives? And if I don't sign up initially for Part D, will I incur the penalty? And I think you had told us yes, but are there cheaper ways to handle Medicare Part D if you're not really using a lot of drugs right now?
Yeah, so we get that question a lot of times from people that they don't use any medications when they turn 65. So they don't want to sign up for a Part D plan because they feel it's not cost effective for them to pay a premium for something they feel they won't use. But some considerations for that, bear in mind, besides the penalty, is the fact that sometimes people's health situation change unexpectedly. And you may need a drug, in the middle of the year that you're not taking currently, right?
Right.
And so it's not, for most people, if they develop a condition in the middle of the year, they're not allowed to enroll based on that. They have to wait till the annual period. Okay, so some people may want to choose a plan just to have something in place should their situation change. And next year for 2021, there's a plan from SilverScript that's a little more than $7 a month. Okay, and some people may just want to take that, if they don't use any medications. Again, that's the lowest cost premium plan, just to have coverage, to avoid the penalty, and if their health situation necessitates their needing a plan in the future.
So a friend's father just learned that because he was a retired veteran, he could actually get his drugs through the Veterans Administration instead. And so then are you allowed to cancel your Part D, or are you just not using it anymore?
Yeah, so that's a good question. So the veteran, the VA drug coverage, Part D, the VA drug coverage is creditable drug coverage. Veterans that have drug coverage through the VA who don't sign up for Part D are not penalized later. Now, some veterans may want to have both.
Mhm.
This allows them greater flexibility to go outside of the VA system and have the drug covered under a private pharmacy through Medicare Part D. In addition, to answer your question, veterans that have Medicare Part D are entitled to a special enrollment period where it allows them to drop their Part D, which could be a Medicare Advantage plan with Part D if they want to drop that to, and that just to maintain the VA drug coverage. And this is a useful tool for the veterans that are on a Medicare Advantage plan with Part D who want to go back to original Medicare. Veterans don't need to be stuck in a Medicare Advantage plan if they want to. They can use this special enrollment period to drop their Part D, which for them means drop their Medicare Advantage plan with Part D. The first of the next month, they're on original Medicare, no Part D, but that's okay. They have the VA for their drug coverage. So again, that's an important protection for veterans that want to switch from Medicare Advantage to original Medicare during the year.
Great. I'm glad I snuck that in because conceivably there are quite a few people who are veterans listening in, and I did not know that until I recently was trying to help my friend and her father. So thank you. All right. Are the new Advantage plans in 2021? Oh, sorry. Are there new Advantage plans in 2021? And what additional dental, hearing, optical, and other services do they cover? And then it goes on, what are the premiums? What plans offers the most coverage? And I assume then we're getting into like a nitty gritty that you probably have to go have an interview for. But are there some general rules of the road about these new expanded plan coverage?
Yeah, so what you should look at, if you want to compare the details of the Medicare Advantage plans, you should be going to the Medicare website, medicare.gov, putting in your zip code and seeing the available plans for your county. But the problem with that is when you do that, you might come up with 40 or 50 or more plans to choose from for next year. You couldn't possibly compare every single plan. Okay? And unfortunately, on the website, you cannot enter your doctor or the hospital that you like and see which plans they accept. Okay, instead, you would need to check with your doctor, okay, to see which plans they accept to help narrow down your choice. So that's always the first thing I do when I speak to somebody about Medicare Advantage. I'll say, do you have a regular doctor that you use? Like many people with Medicare do, that you're not willing to switch. Check at the doctor's office and see which Medicare Advantage plans they take. Do they take Aetna? Do they take Health First? Do they take Humana, WellCare, United Healthcare, Empire, Emblem, to help, again, narrow down the choice? And then you can use the website then to compare the drug cost, because your drug costs can vary from one plan to another. You would also want to take into consideration the type of Medicare Advantage plan. We said earlier that most of them are HMO plans. So an HMO plan, unless it's an emergency, you're limited to doctors and hospitals that participate. But there are also several insurers that offer PPO plans where they allow you greater flexibility because you can go outside of their network to doctors and hospitals that take Medicare okay, but don't accept that plan. And you'll pay more when you do, and you might pay up front and get reimbursed, but it gives you more choice than those stricter HMO. And I would do that first before looking at those additional benefits. Okay? The additional benefits, including things like dental or vision for hearing, you can also compare those on the Medicare website. You can sort plans to see which plans have those benefits. Just for instance, with the dental benefit, you'll see on the website that most plans provide preventive, routine dental services, cleaning, x-ray, screening. But you'll also see that some plans provide what they refer to as comprehensive dental, where they'll provide coverage for procedures. But you have to look at the details of that. Some plans may have a deductible that you have to meet first. Some plans only cover up to a maximum benefit amount for the year, $1,500, $2,000 for the year. Okay, other plans have greater access to that. Plus, like anything, it's a network of dentists, like it is for all providers in your Medicare Advantage plan.
Right. All right. So some of us have memory problems and are embarrassed to tell people that. And my view is I'm already having memory problems and I'm way too young. So I'm admitting it freely. And so people might not even know what their current Medicare package is. Is there a way to look it up for yourself? Can someone help you? Can you get on the Medicare
Yeah, so the way that
website and see what you already have? Or somewhere else?
yes, to see your current coverage, you can sign up on Medicare.gov. They have a link to what they call mymedicare.gov, mymedicare.gov. You can create an account, and then you can view your own Medicare information right online. Okay, and for people on original Medicare, it could tell you also it's good to view claim information. You can view your claim information online. You can see about preventive services that Medicare covers and when's the last time you had one and when you're eligible again. And like you're asking, it could confirm the plan that you're on, whether it's a Medicare Advantage plan or a Part D plan, whether you get extra help or you don't. Okay, so you have that information. For those that are not able to create the account, you can call Medicare, 1-800-Medicare, 24/7, and they can look that up for you over the phone.
Great. And some of us are concerned about confidentiality with our information on a computer. I'm assuming the Medicare website is pretty secure. It's the federal government. Am I correct?
Yes, it's a secure website, but if people, again, are concerned about, not everyone wishes to is comfortable viewing their personal information online. So the alternative is the 1-800-Medicare, where you can get the information over the phone. Okay, so that's another way to go.
Got it. All right. Sorry. So if if your doctor accepts Medicare, does he or she have to accept your Medigap plan, regardless of whether the Medigap plan provider is United Healthcare, Aetna, or any other provider?
Right. So when we're talking about original Medicare with the Medigap plan, as long as the doctor takes Medicare and Medicare pays, the Medigap plan is just designed to pay the difference, to pay the Medicare cost sharing. It doesn't matter what letter plan you have from whatever insurer, even if the doctor never heard of that insurer. Okay? Medicare pays 80%, Medigap plan pays the other 20%. If instead you're on if instead you're on a Medicare Advantage plan, now that becomes very important because the Medicare Advantage plan, again, has the network of providers, and you need to use providers that are participating with that individual plan to have coverage for non-emergency services.
Thank you. All right, wait, I've lost my questions. I'm getting right back to them. Okay, concerns about Medicare accessibility coverage administration. So this is one question that really breaks out into a bunch of them. So finding a doctor who accepts Medicare. I hear this problem all the time from my constituents on the east side of Manhattan. A number of the participants in today's Zoom expressed concern or asked what to do about their having difficult finding doctors and specialists who accept Medicare as a result of doctors opting out of Medicare, doctors accepting no insurance plans, cash on the barrel, and doctors joining concierge practices. Are you hearing about this problem in other parts of the city, and what can people do about it?
Okay, well, we see this more in Manhattan than other places, certainly, but it does occur in other places throughout the city and state and country, where doctors have opted out of Medicare. That's the term they use. And when a doctor opts out of Medicare, Medicare does not pay at all for their services, and the doctor's not limited as to how much they're able to charge. They're able to bill and collect up to their usual fee. Now, although it's an ever increasing amount of providers that have opted out, most providers are still in the Medicare program, and people can find them by either going to that Medicare.gov website or by calling 1-800-Medicare. Now, the concierge is different. This is for doctors that have not opted out of Medicare. They're still in the Medicare program. Medicare pays for their services, but they charge an additional amount of concierge fee. Some people may refer to it as $500, $1,000, $2,000, just to have access to that provider, just to be part of that provider's practice. Okay, and it's not, Medicare allows that because they're not billing from, it's not for medical care. So if it's an office visit, they can't bill $500. Medicare limits them. So that's why they have this separate charge, which doesn't fall under the Medicare program because it's not for a particular medical service. And, that's just an arrangement that you make between you and the provider. And we are seeing more providers, like you mentioned, that do have that concierge fee. Yeah.
So it was suggested to me when my parents both became very elderly and became quite ill and they were going to need different kinds of doctors, that what I should do is figure out what hospital they wanted to be cared for in if something came up, because as you get older and older, the chances that you might need hospitalization also increase. So what I did was I did searches on the several hospital websites where it will actually show what insurance each doctor takes or accepts. So I was able to look up doctors in specialty fields that were in the hospitals I was considering for my parents and find doctors who at least took Medicare. Now, I'm not suggesting that's a way you find doctors, because you still want to find the right doctor for you. But if you're computer literate, that is another way I've learned that, at least in New York City, you can see what insurance they seem to be taking. That's
a good suggestion to get an idea. Yeah.
Yeah, got it. All right, we've actually gotten through the questions, and it's 3:26. Well, that sort of worked out perfectly, didn't it? But we also have something like 49 questions in the queue from people who, oh no, my eyes are bad, 18 questions in the queue so far that I know we didn't get to. But that's okay, because if you're watching, you now know, and you have ways to look up how to get to HIICAP and go through your questions for yourself with them. I think we're also putting up information about the Medicare Rights Center, which is also a valuable resource for people in trying to get clarity on situations that sometimes come up. You can find my office. You've already found me if you're listening to this video or on the phone. And I have amazing staff who do amazing work every day for my constituents. Thank you to them, who will also be available for follow-up questions and help direct you. In closing, besides wanting to, of course, again, one more time, thank Eric for his time and his expertise, and that we really do appreciate your being with us today. I want to remind everyone that our next scheduled town hall is on Wednesday, December 2nd at 6 p.m. And we'll be focusing on mental health impacts of the pandemic. And let's be honest, this has been going on a long time and it's not stopping anytime soon. whether you know it or not, you are having mental health responses to living in the world we're living in right now. So I think that that's also going to be a very interesting, broadly useful workshop for everyone, because it's fine to say it's all okay, this isn't impacting me, and maybe it's not, but I'm going to bet for most of it, it's we answered the phone, yes, of course, everything's fine, but we all know it's not normal. We're cut off more than we've ever been cut off before in social interactions, and even in just walking around and seeing people. And we're not going to our jobs, we're doing it over the phone and over the Zoom, and all of those issues build up. So please, 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 for anyone who says, I don't talk mental health, you don't have to talk mental health. You could come in and listen, and maybe we'll find some valuable tools for yourself. So stay safe, wear a mask, social distance, wash your hands, and really, if you don't need to be in an office building, in another enclosed place, in a restaurant, inside or outdoor, again, enjoy their great food by having them deliver, tip the delivery person extra because they're suffering as well. And let's just get through this all alive. Thank you, everyone. Take care.